Hi guys, what's up? In this video we'll focus on peripheral artery disease. So peripheral artery disease is common circulatory problem in which there is narrowed arteries, reduce blood flow to your limbs. When you develop peripheral artery disease, your extremities, especially your legs, okay, don't receive enough blood flow to keep up with demand. So peripheral artery disease has been estimated to affect 20% patient between the ages of 55 to 75 years old. Okay, so only 20% of patients present with symptom. The common symptom is intermittent claudication. So now let's focus on pathogenesis of peripheral artery disease. Okay, in developed country, almost all peripheral artery disease is due to atherosclerosis, and risk factor are the same as in patient described in patient with coronary artery disease, as I mentioned it in previous video. Okay, so as with coronary artery disease, a plaque rupture is responsible for the most serious manifestation of peripheral artery disease, and not infrequent occurs in a plaque that hitherto has been asymptomatic. So the clinical manifestations depend upon anatomical side, the presence or absence of collateral supply, speed of onset, and the mechanism of injury. Okay, so approximately 5 to 10% of patients with peripheral artery disease have diabetes. Okay, this proportion increases to 30 to 40% in those with severe limb ischemia. So let's focus on clinical features. Symptomatic peripheral artery disease affects the legs about 8 times more than the arms. So several locations may be affected, including aortoiliac vessel, femoral popliteal vessel, infrapopliteal vessel, and in the arms, subclavian artery is the most common site of disease. So peripheral artery disease can present clinically in a variant of ways, such as intermittent claudication, critical limb ischemia, acute limb ischemia, Atheroembolism, and subclavian. And now let's focus on the first one, which is intermittent claudication. This is the most common presentation of peripheral artery disease affecting the lower limbs. Okay, it's characterized by ischemic pain affecting the muscles of the legs. So the pain is usually felt in the calf. Why? Because the disease most commonly affects the superficial femoral artery. Okay, but it may feel in what we call in the thigh and buttock if the iliac artery is involved. So the pain typically comes on after walking and rapidly subsides on rest. And now let's focus on the second one, which is critical limb ischemia. In the critical limb ischemia, CLI is defined as rest pain requiring opioid analgesia. Okay, that plus minus ulceration or gangrene that has been present for more than 2 weeks in the presence of ankle blood pressure of less than 50 millimeter of mercury. And now let's focus on the third one, which is acute limb ischemia, ALI. And this is most frequently caused by acute thrombotic occlusion of pre-existing stenotic arterial segment, thromboembolism, and trauma that may be iatrogenic. And now let's focus on signs and symptoms of acute limb ischemia. Pain, pallor, pulselessness, may be absent in complete acute ischemia. Okay, and can be present in chronic ischemia. Okay. Paresthesia and paralysis. These are an important feature in what we call impending irreversible ischemia. Let's focus on the fourth one, which is Atheroembolism, may be a presenting feature of peripheral artery disease affecting the subclavian artery. Okay. Presentation is with blue finger, which is due to what we call a small emboliology in the digital arteries. This may be confused with what we call Raynaud's phenomenon. And let's focus on the fifth one, the last one, which is called subclavian. Still, this can be feature of peripheral artery disease affecting the upper limbs. Okay, the presentation is with dizziness and cortical blindness plus minus collapse. So now let's focus on investigations. In the investigation, so the presence and severity of ischemia can usually be determined by clinical examination, I mean, such as pulses, diminished or absent, bruits, reduced skin temperature, pallor, muscle wasting, and what we call loss of hair, okay, and skin and nails dry, or what we call thin and brittle. Okay, in the further investigations such as duplex ultrasonography, MRI, CT, and what we call full blood count to look for evidence of treatable secondary causes such as thrombocythemia and measurement of lipid to check or look for evidence of hyperlipidemia and measurement of blood glucose to look for evidence of diabetes. The last one is management. Medical therapy for peripheral artery disease is walking cessation, regular exercise, mean 20 to 30 minutes of walking 2 to 3 times per week, okay, and what we call antiplatelet agent such as aspirin 75 milligram or clopidogrel 75 milligram daily, reduction of cholesterol, okay, such as diet, statin use, and weight loss. Okay, fourth one is diagnosis and treatment of diabetes mellitus. Okay, and the last one, diagnosis and treatment of associated conditions such as anemia, hypertension, and heart failure. And the last thing is subclavian artery disease is treated by means angioplasty and stenting, which is what we call carotid subclavian bypass surgery can be technically difficult. Okay, that's all about peripheral artery disease. Hope you get a benefit from this video. Thanks for watching.